here today. Recently, we had Jace Killsback from the Indian Affairs Committee. He's Executive Health Manager for Northern Cheyenne Tribal Board of Health. In his testimony last month, he said, and I quote, "It has become normal and okay to be misdiagnosed and to wait until you're going to lose a leg or your life to receive the right health care that you need." I know as I travel around Indian country in Montana, there aren't a lot of folks back home that are real happy with the outcomes. We've heard a lot today about spending on various programs, not much on concrete outcomes for tribal communities. Just a question, what would you say are two or three of the most important metrics you look at in terms of outcomes, in terms of improving Indian health that you evaluate here in terms of whether it's working or not?
I think we have very important outcomes in several areas. One is I think we have made tremendous strides with addressing diabetes in Indian country. The childhood obesity rate is going down, and also I think the incidence of type 2 diabetes has stabilized over the past few years. That's one example.
If you were to try to take it up to the, I mean, you quoted a couple that we've made some progress, but if you just kind of step back and try to evaluate the success or failures of a program, what are the top three outcomes you say really are good measures in terms of whether or not we're improving health in Indian country?
I think, Senator, one top-line measure would certainly be, I think, the overall life expectancy in Indian country, which I think we've shown progress over the years, over a long term. That would be one high-level measure.
What else?
I think looking at health disparities across other populations would be good measures. I know that there has been some progress made, but more progress needs to be made on those health disparities.
Yeah, my concern, and looking at the testimony here, is we've invested another $2 billion in IHS. It looks like round numbers here. You mentioned the 53% increase if we're funded at the president's request versus 2008. So we've put approximately $2 billion more plus or minus in the programs, and that's a big relative to about a $4 billion base, roughly, and about another $2 billion. And the question is, what's improved because of that? Because I hear, just again, a lot of concerns about outcomes in Indian country. I don't hear a lot of feedback where they say we're very pleased with IHS. To the contrary, I think virtually everywhere I go, I hear about the challenges and the failures of the program.
Yeah, no, Senator, I share your concerns. I know that there are a lot of issues. I know that I have heard personally myself from a number of patients and people in tribal communities, but I do think there are a lot of dedicated people who work at IHS as well, and I know that there's also a lot of good work, but that's not to diminish the challenges that you are talking about.
Yeah, my request to be when we look at budgets, of course, you got to look at where the spending is going to be, but also to bring the outcomes, bring the metrics. Let's go back to 2008. Let's go back, or let's say 5-year timelines in terms of are we getting better or not? What are the top 3 to 5 measures that really help us understand better? Is Indian health getting better or is it getting worse as we look at the investment choices and prioritizing on it? And along that line, when Dr. Rubidoux was here, she cited the IHS admin costs at around 10 to 11% of the total. It looks like now, well, let me ask you, what are the admin costs as a percentage of the overall budget for this year?
I think the IHS-wide administrative costs are at 12%, and then some of the areas are lower than that.
Yeah, so overall, so if I'm just looking at what Dr. Rubidoux told us and then the 12%, it looks like the percentage of administration costs are actually going up versus going down. And typically when budgets are increasing, oftentimes because you've got a bigger denominator, the admin costs will start going down. And having spent many, many years reviewing budgets in the private sector, why are admin costs going up?
Senator, I'm not, I have to look back at the number that Dr. Rubidoux gave you. I'm not aware that they're going up between 11 and 12, but we certainly look at that, and I will say that we are committed to, I think your points are well taken, we are committed to ensuring that we are efficient in how we spend the funds and that we have deliverable outcomes and metrics and timelines for achieving results.
Yeah, part of the overall challenge here. I'd like to see some clear goals set, that we want to take admin costs as a percentage. If we're at 12% today, how do we get to 11%, 10%, 9% over the course of the next 3 or 4 years? Because every dollar spent in admin arguably is a dollar taken out of getting the help to the people here who need it the most in Indian country.
Yes, Senator, thank you so much, and we definitely can take a look at that. I share your thoughts on that.
And again, that's just my concern, is disproportionate spending on admin costs doesn't translate into better care in Indian country. A recent study showed in Montana that white men live 19 years longer than American Indian men, and white women live 20 years longer than American Indian women. I know there's other factors involved, but I do believe it's unacceptable that we've reached disparities like these under the watch of IHS, and I urge you to address the real health challenges facing Indian country and really turn the focus back to results versus just activities.
Thank you, Senator, and I totally agree, and that is a point well taken.
All right, thank you, Mary.